Thank you. Thank you so much. Good day, everyone. I'm very happy to be here, and thank you so much to Emir and Anas for inviting me here today. So I'm just going to quickly share my slides, and today I'm going to essentially talk about a topic that's very close to my heart, which is essentially advanced connectivity, and how we at the National University Health System here in Singapore have been sort of trying it out over the last few years, and more importantly, where do we see this whole field and this whole area going in the next, 5, 10, 15, 20 years? Right. So just to begin, the National University Hospital is part of the National University Health System. We are one of three health systems here in Singapore, and we are the main university hospital here in Singapore as well. Now, when it comes to the essentially what we look at the revolution or industrial revolution in healthcare, I think it pretty much mimics what we're seeing in the other industries as well. For example, finance, manufacturing, in the sense that we are in the fourth industrial or healthcare industrial revolution, moving away from, for example, first generation paper records. Where everything is very knowledge intensive and based on recall and memory, and now into fully automated or even automation and physical systems integrating into one single space. And the entire AI revolution in healthcare, it is not something new. We've been seeing it progressing over the last 5 to 10 years, but admittedly, over the last 5 years or so, we've seen the growth being very exponential in both the adoption as well as innovation for AI in healthcare, right? And just to go through a few examples. So, for example, medical imaging, right? One of the earliest users of AI in healthcare is with essentially automated diagnosis when it comes to medical imaging. So, the use of AI to analyze X-rays, MRIs, CT scans. This has really changed a lot of the utilization of AI as well as the reporting of diagnostic scans in the healthcare system. And as you can see, not just the accuracy, but the speed at which we can look through patient scans, it has increased tremendously over the last few years. Early warning systems, we're all quite familiar with prognostication or warning systems. So, for example, the sepsis models, kidney injury predictors, these are predictive models that essentially uses AI and machine learning to look at patient parameters, to look at patients' blood tests, scan results, and give the healthcare workers a prediction of how likely the patient's disease for example, progress, or how likely it is that they will recover based on the given treatment. And of course, its use in mental health has increased over the last few years as well. The whole field of medtech innovation and connected care, one of the biggest changes when it comes to health behavior is actually not a medical device. It is not something that you would expect to be coming out from the hospital or directly from the healthcare sector, but it's actually the smartwatch, right? Over the last 5, 10 years, the use of smartwatch has increased tremendously, and the amount of health data that you can gain from this smartwatch and wearables and wearables is essentially invaluable, right? And studies have shown that the information or the data that's collected from wearables and smartwatches change patients' behavior or health-seeking behavior more than any other form of healthcare intervention. And this is essentially the power of the wearable revolution. When it comes to telehealth, telemedicine, telesurgery, before the pandemic, telemedicine has been there, but we all know that throughout the pandemic itself, because of restrictions, because of physical limitations, the uptake of telemedicine has increased as well. And although there is a drop in the use of telemedicine after the pandemic has more or less ended, it has continued on, and a lot of healthcare systems have changed the way that they deliver healthcare to their patients by incorporating telehealth and telemedicine into their routine services. And of course, the whole new area of surgical robotics, not just using robots in the operating theater, but I'm sure many of you have seen more and more case reports or use cases where there's remote surgery, where a surgeon in one country is operating on a patient in another country, right? And again, in order for all these things to happen, you need an extremely reliable network to prevent failures in the system and to make sure that all these are running smoothly every single second, every single day. The whole area of immersive technology, or as perhaps we can call it the healthcare metaverse. Again, it is not a new area, but we have seen exponential increase in the uptake and adoption of technology in this area. The simplest form, right, for example, using it for medical education, right, using XR devices to teach residents how to appreciate applied surgical anatomy, physiotherapy when it comes to patient use, but our patient education, again, these are invaluable resources that we have seen in the healthcare systems over the last few years. And of course, the whole area of knowledge management. Right now, we have easy access into a lot of new AI applications, especially large language models, right? How do we then do knowledge management? How do we make sense of all these different resources that we have essentially at a touch of our fingertips? How do we incorporate all these LLMs and new, agentic AIs or, generative AIs into the healthcare system so that we can leverage on the new developments to help us to take care of our patients better? And of course, new area that we are all quite interested in, which is essentially spatial AI. Now, a lot of times when we look at essentially AI or machine learning, um, in the traditional sense, it is sort of looking at data in a two-dimensional world, right? We look at numbers, we look at big data. You can look at it on a time scale, but again, the data is more or less on a flat plate. When we talk about spatial AI and spatial computing, essentially it's training the AI to understand that we live in a three-dimensional world and not a two-dimensional world. So how do we integrate geospatial data into the AI? How do we create spatial awareness? More and more, we are seeing computer vision based intelligence where the AI or machine learning algorithms are able to recognize what it's seeing on images. And for example, coming from the robotic cameras or the laparoscopic cameras inside the patients. And of course, the whole field of immersive technology and the blending of the reality and virtuality continuum in order for the healthcare system to really make use and integrate of all this new technology, new innovation, new capabilities coming up in the space, we have to figure out how do we support all this, right? Because one of the dangers that we have, I think is not specific to healthcare, but to many industries in general, is that as we onboard new capabilities, as we onboard new applications, we run the risk of building additional silos into our systems, right? And we need to figure out a way to break down the silos and to bring all these individual applications or individual solutions into one single network and into one single ecosystem. And I think that's where the whole area of advanced connectivity can help to fill that space. So over here in NUHS, how do we start looking into advanced connectivity and how we began this journey of migrating our systems bit by bit from a Wi-Fi based network into the future, hopefully a 5G or 6G or 7G based network. And it really started with a single use case, which is the use of mixed reality in healthcare. Right. So when we started this project, we wanted to see how mixed reality can change the way we deliver healthcare to our patients, right? Enhance our clinical capabilities, improve clinician experience, and of course, at the end of the day, to improve patient outcomes for the patients that we treat. Right. So we started our XR journey in the use of mixed reality in December 2019. That's when Microsoft first launched the HoloLens 2. We were invited to a workshop with the Microsoft office here in Singapore. And after a half day of brainstorming, we decided to do a small proof of concept and trial in our hospital for about 6 months. We were doing this right in the middle of the pandemic, and which is why things got a little bit delayed. But I think that's also one of the reasons why it helps us to recognize that this is an area that we can bring into healthcare to improve the way we deliver health to our patients. Right. So we started our trial in September to December 2020. We spent 6 months testing out the devices, bringing it to different specialties in the hospital. And in January 2021, it became a strategic R&D program here in the hospital itself. Now, in simple terms, the way we first began using it was simply to convert patients' scans that we usually see on a computer screen in 2 dimension into 3 dimension holograms. Right. So for example, MRI scans, CT scans, PET scans, any form of what we call volumetric DICOM images, we will upload onto the device, and essentially convert them into 3D holograms. And using these 3D holograms, we will actually use that to do our surgical planning and be able to appreciate the patient's anatomy in 3D. Now, just a caveat, the following slides, I will be showing, videos and photos from actual surgeries. I promise that there won't be a lot of blood, but this is to demonstrate essentially how we use this technology in the hospital here in NUH. So, for example, in this case, this is one of my patients who was going for a liver transplant. So, what we did was that essentially we use an AI application to do automated segmentation, and we can essentially segment and isolate the different structures inside the patient's liver. For example, the blood vessels going in, the blood vessels coming out from the liver. We can even do like a virtual cut through the liver itself, based on how we intend to do the surgery, and essentially have a full virtual walkthrough of the surgery before the day itself. And what you realize, or you can see, is that we control the images just purely using gesture control. And that's something that's very important in essentially how we use it in the operating theater. So in the operating theater itself, we started to do what we call surgical image guidance, where we bring the 3D holograms that we created for the patients out from the office into the operating theater. So for example, in this case, this is a MRI scan of the patient's brain that's superimposed on the patient on the operating table. And we use this as a form of image guidance to tell us, for example, where the tumor is inside the brain, where are we going to make our cuts and incisions during operation itself, and how do we plan to remove the tumor. Now, as we got more and more into the use case application where it requires a lot of real-time rendering, for example, in this case, where the cameras are essentially doing real-time mesh generation of the environment all the time. We are uploading coordinates and we're uploading, anchor data into the cloud all the time. We realized that the Wi-Fi network in the hospital was completely useless, especially in the middle of the day when everyone is connected to the Wi-Fi network. It becomes so slow that essentially it becomes unusable, right? So our very initial foray into 5G technology was purely based on the requirement for a high bandwidth, low latency network to support our use cases. Right. So what happened then was that in 2022, we were fortunate enough to receive a grant from the Infocom Media Development Authority in Singapore. This is a government-linked agency where they, not only control or do the licensing for the bandwidth here in Singapore, but they do issue innovation grants, and we're fortunate to be part of this 5G innovation program. And using the grant that we got from IMDA, we essentially set up a virtual private 5G network within the hospital, and also that covers the entire country. So what we did was that we renovated the hospital, and retrofitted 10 of our operating theaters with its own indoor 5G antenna, and 3 of our wards in the hospital with its own indoor 5G antenna. Right, these are some photos from the renovation process itself. It took us about 9 months to get this going, because we had to do the renovations in a hospital that was operating operating as per normal. So, for example, in the operating theaters, excuse me, the contractors could only come in on Friday night. And they start work on Friday night. They work throughout the night to Saturday morning. Saturday morning, they pause work because there'll be some additional surgeries going on. And then after that, they come back again on Saturday night to do the renovations into Sunday morning. And then after that, they will hand over the operating theaters back to the ORA committee for patients to come in for their routine surgeries on a Monday. So this is done together with Ericsson, that's our hardware and solutions providers, as well as Singtel, who are the telecom service providers here in Singapore. And all we end up with essentially is this small little antenna or disc on the ceiling, which is our indoor 5G antenna in the operating theater. But what that allowed us to do was to essentially have a very high throughput network inside the hospital that is dedicated for our medical applications, right? Because only devices with our enterprise grade SIM cards are able to have access to this network, which means that people watching YouTube, Netflix in the middle of the day will not disrupt our services, right? So we are able to get on average about 1,000 megabits per second of downlink speed and almost 250 megabits per second of uplink speed with an average latency of less than 10 milliseconds. But what we also realized as we got to understand 5G technology a bit more is that as 4G, as wireless technology transitioned from 4G to 5G, it moved from a hardware based network into a software based network. And with a software based network, what we realized is that we could essentially do a lot of customizations for the network itself. So, for example, in this high level network diagram, this is one of our first new network architectures where it allows us to transmit identifiable patient information from the intranet zone, which is a protected zone inside the hospital, right, through our cloud services, through our border control service, into devices that essentially have internet access, right? This is something that was not done before and definitely not possible without having a software-defined network such as 5G. And this is essentially one of the very first networks that approved by the Ministry of Health in Singapore that allows us to do this in real time. And we could only do it because we could demonstrate one of the key factors of 5G, which is the security aspects of the network itself. And because now we are able to essentially have our own enterprise network, um, our deployment concept is such that we don't deploy a private bubble inside the hospital, whereas we essentially deploy what is known as a virtual private network, which means that we have an enterprise core that can write on the public hardware infrastructure. So, for example, the outdoor antennas that's around Singapore, as long as the 5G core is connected to those antennas and I have my 5G enterprise SIM card anywhere within the country, I have access to my own virtual private 5G network and I can guarantee that it will not mix with the public traffic. So these are some of the examples of the customized data networks that we use now that we have our own 5G system, right? In the past, what happens is that a lot of the use applications or the solutions that we have that requires a little bit more processing and computational power, we can't do it on the XR device or on HoloLens itself because it doesn't have enough compute. So we had to essentially bring either a high performance laptop or a high performance workstation and bring it around the hospital in order for us to run these applications. But ever since we have deployed our 5G network, what we have done is that we have installed those AI applications into the edge computer services in Singtel. So we have virtual machines at the Singtel data center, and we've installed our AI applications onto those edge computers. And essentially, we just run the entire application through the 5G network with the edge computers doing all the compute. and we don't have to carry around our laptops anymore. So instead of having one XR device with one laptop, we can have multiple XR devices connected to the 5G network that is able to tap on our AI applications and AI software that's installed in the data set itself. So again, allowing us to scale beyond what we had previously without such an integrated network. So what it allows us to do essentially is to be able to do things like this, right? Where we can superimpose the images and the holograms onto the patient on the operating table and know that the images will be stable. There will be no delays, there'll be no device failures, network failures, and that gives us the confidence to use this routinely in the operating theater. Right. So, for example, in this case, right, this is one of my colleagues who uses this routinely now for surgeries of the rib cage. So this is of a patient who was going for a surgery to remove a small tumor in the rib cage itself. And what you're seeing here essentially is the hologram of the CT scan being superimposed on the patient on the operating table. Um, we are still using an ultrasound scan to identify where the tumor is. But as you can see, right, it's this essentially blob in the middle here. That's where the location of the tumor is. Now, once we are happy with the image registration, unfortunately, because of hardware limitations, the registration of the image on the patient is still a manual process. But once we're happy with the manual registration, we'll lock the image in place, and the surgeon actually wears the device as they're operating to have this image in front of them. So when they start the surgery, they just make a very small cut over the area where the tumor is. They go all the way down to the bone, and once they are at the correct the location of where they think the tumor is, they simply bring back the hologram like this to make sure that they are on target, right? So without a very reliable network, without low latency, high bandwidth, things like this will not be possible. You will not get images as stable as this. You will not get images as clear as this, and you definitely not be able to have AI that's running in the background doing real-time remote rendering and giving you these images without that network, right? And this is another example of how we are using the network itself to leverage on advanced connectivity and AI. So this is an application that we built in the hospital where we use the infrared camera on the HoloLens to detect superficial veins underneath the skin in real time. So those blue lines, those are essentially the veins under the skin. So there is no pre-imaging. This is done purely by looking at the difference between the infrared signal of a blood vessel and the skin next to it. And the AI algorithm is essentially installed on the edge computer on the 5G network. This is another example of what we call point of care solutions, where we are doing point of care bedside ultrasounds and doing near real time 3D reconstruction. So if you can remember, for example, watching movies where a little probe scans the patient and it goes that zzz, like this, and the image comes out in a few seconds. This is essentially what it is, right? So if you look at the photos on the top right, we do a sweep of the ultrasound probe over the area of interest. In this case, it's one of my colleagues' neck. And using the 5G network itself and using the edge computer service and our AI algorithm that's installed in the edge computers, we're able to stitch those images together, use the AI to run and to segment those images. And what you see here, essentially the green part is the trachea or the windpipe of the patient, and the blue part is the thyroid gland of the patient. Right. So again, without a very reliable high-speed network, this will not be possible. And you cannot do this at the patient's bedside or even in the patient's home without having large bulky equipment to bring along with you. right? Of course, the incorporation of haptic gloves, right? These are wireless haptic gloves that's developed by a team that I work with here at the university. So what it does is that there are pneumatic bubbles or pneumatic pads on the inside of the gloves, and you can actually feel the holograms that you're seeing on, in this case, the HoloLens devices, right? And again, that level of integration, that level of AI and application is running in the background, you need to be able to do a lot of real-time compute in order for you to feel that hologram in real time. Again, you need a network that can support this, right? And of course, going into the whole concept of digital twins, right? In this case, when I talk about digital twins in this scenario, it is not talking about digital twin, for example, of architecture designs of the hospital, but it's about creating virtual models of the patient's organ based on their own data. Right. So this is an example of how we're working on digital twins in our hospital. So we are creating a virtual replica of the patient's liver using their own biophysical properties that we get for example, an MR elastography scan of the patient. Then we use a technique that I'm sure many of you are familiar with called finite elements modeling, where we divide the liver, in this case, into 500,000 individual elements. And each element that you see here represented by a triangle is assigned its own biophysical property based on a three-dimensional MRI scan that we do for these patients. And when we compute essentially how one element interacts with the next element around it, and we extrapolate that to the entire liver, you get something like this. Now, being able to predict how the liver is going to behave to external forces, how it's going to deform, right? And how the external force is going to be translated into internal movements. The importance of a digital twin like this is so that we can convert those 3D holograms and 3D images that you see, which are essentially static, right? They don't move, into something that is dynamic like this, right? It responds to movements and not just any random movement or deformity of the organ, but deformability based on the patient's own biophysical properties of their own liver. So this is essentially a customized virtual replica of the patient's own liver. And we use this essentially for surgical navigation, right? So for example, in this case, right, where we have a camera from a surgical robot looking at the liver, instead of, nowadays where you have a static mesh or a static image of the liver that's superimposed on it, the computer vision essentially recognizes the shape of the liver. It recognizes that it's looking at the liver, and using real-time 3D mesh generation as well as point cloud creation, we can then superimpose that liver or the virtual liver onto the actual liver on the operating table. And as you move the real liver around, the mesh is going to move correspondingly. And that allows us to say, for example, this little purple dot in the middle, right? If that's a very small tumor inside the liver, the AI is going to tell me how that tumor is going to move about inside the liver as I'm doing my surgery, so that I don't come too close to it, right? And accidentally expose the tumor during the surgery itself. And of course, the whole area of remote medical assistance. So this is a um, project that we have with a charity hospital in Ghana, where the surgeons in Ghana actually wear the Microsoft HoloLens devices and live stream the surgeries sitting in my office back here in Singapore. So they use a 4G connection over there in Ghana because they do not yet have 5G. But over here in Singapore, we have our 5G connection. And this is what you see. I have a first person view of the surgery that is essentially happening, thousands of miles away. And with a dedicated network, you can see that there's almost no delay, right? I can talk to the surgeon on the other side. And with essentially the use of spatial AI, for example, in this case, I'm drawing two lines to tell the surgeons in Ghana where to put two stitches during the surgery. on their device, they see those two blue lines superimposed on the patient, right? So this is spatial AI working in real time, right? Because they are not looking at a two-dimensional screen. They are looking essentially at three-dimensional images that's projected onto the actual patient. So now there's no more guessing, when I say, oh, cut here or stitch there, they know exactly what I'm talking about. And of course, the next day, when they see the patients in the ward, I can join virtually to help them review the patients. I can see the wound. I can talk to the patient. They see me as a holographic screen on the visor itself. Again, being able to bring tertiary level advanced medical care to areas that are traditionally quite difficult to reach. And you have to send in physical teams, which may not always be feasible. Right. And what they have then done is that we have actually brought these devices out into the villages, but for medical outreach trips. So this is one of the trips that we went with them, where we drove from the hospital about 1.5, 2 hours out into a remote village. We set up a van with ultrasound machines and everything inside. And we actually brought along one of the 4G routers with us. And we connected the HoloLens devices to the 4G router and live stream the entire consultation to doctors who are sitting in the main hospital. Right. So essentially, this is telemedicine at work, right? Where it is not a patient consulting a doctor, whereas it is a junior doctor that's out in the field consulting with senior specialists inside the hospital and being able to get that real time assistance when it comes to dealing with potentially complex cases in the community. And because now in NUH, we understand the concept of advanced connectivity more and more, what we see is that advanced connectivity is not just purely about you know, low latency, high bandwidth, high speed data transmission. And when we moved away from a hardware defined network into a software defined network, the network itself becomes part of the AI solution. Right? So instead of dealing with a pipe, which is essentially in simple terms what hardware defined networks are, we are essentially having an entire, processing plant now with software-defined networks. And that's why we have decided to onboard more and more applications onto our 5G network. So for example, we have a program where we are developing autonomous robots in the hospital. These robots are meant to be companions to the nurse. They do functions, for example, assist the nurse when it comes to certain tasks in the wards, bringing medications from the central pharmacy to the patient's bedside, doing counseling for the patients. And this entire system runs on a digital twin that's based in the cloud itself. There is very little on-device or on-board processing in the robots. There's only some basic navigation functions. Everything else, including the task management, the fleet management, the route optimization, lift integration and all those, it is all done in the cloud and transmitted to the robot via the 5G network. So the robot sends information and videos to the cloud processors using the 5G link. And after that, the information comes back down onto the robot using the 5G link as well. Home care based solutions. What we have done right now is that our hospital at home program has been onboarded onto our 5G network also. So these are essentially mobile teams of nurses and doctors who will visit the patients in their homes. These are patients who are well enough to be monitored at home and not in a hospital. And they are the tablets that they carry out into the field right now has been onboarded onto our 5G network as well to give them that dedicated slice and a dedicated channel for uninterrupted use, no matter where they are in Singapore. And of course, facilities management. So this is one of our first use cases into the IoT ecosystem. Those lamps that you see on the ceiling, these are UVC sterilization lamps that are installed in the operating theaters. So all these lamps are essentially connected to a cloud platform through the 5G network, right? So the telemetry for these lamps, individual lamps, are live streamed to the dashboard on the cloud. We can control the intensity of the lamps. We can control which ones are turned on, which one are turned off. So essentially, the first step into building the IoT ecosystem that's based on advanced connectivity for the hospital itself. But what we see essentially is that a software-defined network like 5G, in the future 6G, 7G, is an opportunity for us to build the next generation of integrated networks, right? And move to intelligent health and not just connected health. Because where we see cellular communication like 5G is that essentially um, forms a sweet spot between what we consider three essentials for the next generation of healthcare network. So security, platform, and ecosystem. I call it XG because the numbers are just going to keep increasing, right? But as long as it stays within this sweet spot of the three essential services, right, this is where we can really leverage on a network to help us build on the next generation of healthcare infrastructure. And what we need to move is away from connected health, which is a thing of the past. Right now, most devices are in one way or another connected. Right, I think we are at a stage where we are looking at integrated health, where we are trying to break down all the individual silos and start bringing all the applications into one ecosystem to allow us to move into a space that I would like to call intelligent health, right? And intelligent health is not just about the clinical services in the healthcare system. It is about the non-clinical services as well. So, for example, the air conditioning sensors, the temperature sensors, the humidity sensors in the operating theaters, in the wards, all this form part of a smart ecosystem in order for the hospital to be a truly smart and intelligent hospital. And of course, one of the things that we're trying to do is to create a bi-directional end-to-end communication channel for any device that's connected onto the 5G network to have direct access to the patient's information, right? So right now in Singapore, we do have an issue where there's a separation of the intranet zone where the patient's information lie and the external environment where, for example, the medical devices or the patient wearables exist. With a new 5G network, it gives us the opportunity to create a customized data network where essentially any device that's connected to the hospital's private 5G network is considered an IoT device, and it can stream information directly into the patient's electronic medical record system. So you don't need any intermediaries. There is, no additional steps in between that can be prone to, for example, security breaches. And I think this is where we are working on towards the future, at least here in NUH, into building a true integrated, not just platform, but ecosystem for healthcare data transmission to happen. And of course, having the ability to make sense of those data to improve the way we deliver healthcare to our patients. And essentially forming this whole idea of an integrated network where you have different use applications, different use cases, different solutions in the entire network, but you have one single platform in order for you to bring all this together into a full ecosystem, right? And I think this is where the opportunity for future research and development really comes, right? The development of the clinical IoT system, for example, new devices, new wearables that the patients have. Integrating edge computing as well as analytics platforms into this clinical IoT ecosystem for us to move from integrated health into intelligent health. And in terms of the whole space of development for advanced connectivity, it is not a single solution. It is a platform enabler for us to build more and to essentially make the entire network the AI and the brain itself, right? So moving into spatial and embodied intelligence, for example, the possibilities of having a hospital digital twin, extended reality patient monitoring, right? The use of the research into advanced connectivity into ultra-reliable networks, 5G, 6G, multi-layer dynamic computing, right? How do you balance edge versus cloud processing for optimal performance? How do you balance between heavy models and light models to give you the real-time feedback? And of course, like I mentioned before, the whole idea of a medical IoT ecosystem where every single device, be it, for example, a patient wearable or environment sensor or air quality sensor, forms part of the entire ecosystem of data integration. I think that's where we believe that the next generation of healthcare networks is going to go with the aid of advanced connectivity. Now, of course, there are going to be a lot of hurdles and limitations and challenges that we have to overcome along the way, all the way from technology readiness, platform readiness. Are agents really ready to run the digital twins of the hospital for us? All the way into system acceptance. Are we willing to say this is going to be the new norm of is the next generation of healthcare networks? But of course, at the end of the day, when it comes to innovation, this is the a quote that I like to use when I finish my talks, is that do not fear failure, but be afraid of not having the opportunity to succeed. And with that, I've come to the end of my presentation, and hopefully you guys have enjoyed it and very happy to take any questions. Thank you.